If the patient has been undergoing some other kind of trauma or issues related to like even childhood physical abuse or sexual abuse, it can start even 1 week before the periods and it become more severe during the cycles, and it may persist 3-4 days after also, causing too much anxiety, depression and the relationship strains, usually because of the neurological pathway. There is a problem in the neurological pathway.
Hello dear friends, good evening. We are back with yet another episode of BMC Global Live Al-HILAL Health World, Nothing But Lifestyle, a talk show with the doctors of Al-HILAL hospitals and medical centers. Today we will be discussing about a subject that affects millions of women worldwide, endometriosis. And the doctor joining us today is Dr. Aysha Anjuna, the specialist obstetrician and gynecologist from Al-HILAL Hospital, Muharraq Branch. Doctor, welcome to the show.
Thank you. Thank you for having me here.
So, doctor, for someone hearing this term for the first time, what is endometriosis?
Actually, the term endometrium is endo means within and the metra means the uterus. So, endometrium is the inner lining of the uterus. So, endometriosis is a complex disease condition which is caused by the presence of endometrium like tissues outside the uterus. It can be on the structures which are near to the uterus, like the colon, bladder or the rectum, or it can be distant organs also, like the lungs, brain or the pleura or the lining outside, the even lining outside the heart, that is the pericardium.
Doctor, how common is endometriosis and around what age are women prone to this condition?
Endometriosis usually affects 1 in 10 women, that is almost a 10%. And the age means it's usually, before it was like in a reproductive age woman, but nowadays the thing is endometriosis is very common even in young girls below age 17 and even women who are postmenopausal, because these women are frequently taking HRT, that is hormone replacement therapies.
And doctor, can you now speak about the common causes of endometriosis?
Actually, there are 3 proposed theories for the generation of or the origin for this endometriosis. First was the retrograde menstruation theory, because 70 to 90% of women have this menstrual blood which reflects back through the regurgitate back through the tubes into the pelvic cavity, and this can cause the implantation of the endometrial tissue outside the uterus. That is called retrograde menstruation. And another theory is that a coelomic epithelium, that is the lining of the peritoneum. Peritoneum is the lining of the abdominal structures inside our abdomen. So that lining can that cells and that lining can turn into endometrial cells. And another theory is the induction theory, that is like, as I told, because of the some biochemical markers changes inside our body, the lining of the peritoneal cavity can form endometrial tissues.
And doctor, what are the common symptoms of endometriosis? We know that pain is one of the major symptoms. What are the other symptoms associated with this?
As you told, the pain itself is the main common symptom of endometriosis, and that is the dysmenorrhea, that is pain during periods. And the particularity of this pain in endometriosis is that it can start even 1 week before the periods and it become more severe during the cycles, and it may persist 3-4 days after also. And there can be pain during intercourse, that is dyspareunia. And sometimes patient will present with infertility, that is inability to conceive only, without any other pain related symptoms. And the other main problem because this endometriosis, there is a delay, there is a delay in the diagnosis of endometriosis for about 8 to 10 years. It is because of the insignificant symptoms, that is like symptoms which is not related to gynecology specialty as such. That is, the patients may have bowel symptoms, like she may have bloating, she may have early satiety, and problems in the bowel movements, that is frequent bowel movements or constipation. These all things, symptoms may take them to a gastroenterologist, and she may be end up in diagnosing like irritable bowel syndrome or inflammatory bowel diseases. Then sometimes the patient may just come with urinary symptoms like frequent urination or pain in the lower abdomen when the bladder become distended, or she may feel pain while passing urine itself, which may take her to the urologist. So after all these years of the frequent visit to the other departments, only they may come back to a gynecologist for the proper diagnosis of endometriosis as such. So it may take long time to get a proper diagnosis.
Apart from the pain, how can endometriosis affect the daily life of a woman?
Yeah, the pain itself can affect the quality of a woman, right? Especially in endometriosis, there's a chance that she may end up in having chronic pelvic pain. Chronic pelvic pain means she may have pain throughout the month, not related to the period cycles. So it can affect her work quality. She may have to end up in cancelling family functions or their shoppings or vacations, whatever, because of the severity of the pain. And obviously it may end up in causing too much anxiety, depression, and the relationship strains when it comes to the sexual relation, because it is very painful, and there can be problems between the couple because of these issues.
Doctor, now you mentioned about chronic pelvic pain. What exactly is chronic pelvic pain, and how is it different from the normal period pain?
Chronic pelvic pain is actually it can be non-cyclical. Usually we call it chronic when the pain is there for more than 6 months, and it will be on the same side, and it can affect the functionality of the patient itself, and they may end up in getting a medical help. That is called as chronic pelvic pain, and it is different from the menstrual pain. Usual menstrual pain, it is only because it is non-cyclical. It can come anytime in between, irrespective of the period in menstrual cycle. And the main pathology, actually there are it is actually a multifaceted problem involving it can be because of neurological problems, can be related to musculoskeletal problems, it can be related to adhesions because of the previous surgeries also.
Doctor, now can you explain about the other causes of chronic pelvic pain other than endometriosis?
Yeah, chronic pelvic pain can be caused by other causes like pelvic inflammatory diseases, gynecological causes like pelvic inflammatory disease, or if she has undergone previous surgeries, cesareans and all, there can be adhesions that can cause. And adenomyosis is another issue, that is the endometriosis inside the uterus itself, uterine muscle itself, that is adenomyosis. And other conditions which can cause chronic pelvic pain in women are the bladder pain syndrome, which is related to the urology, bladder itself. Then chronic pelvic pain can be caused by irritable bowel syndrome or inflammatory bowel diseases. It can occur because of neurological factors, that is because of the nerve entrapment in between the sutures of previous surgeries, or it can be because of myofascial pain. Because of this chronic inflammation inside the pelvis, the muscles can get spasms that can cause chronic pelvic pain. Actually, this chronic pelvic pain is not only a structural problem. It can be it is usually because of the neurological pathway. There is a problem in the neurological pathway because there is some structure, the sensory nerves which carry the pain stimuli from the pelvis into our spinal cord. There can be problems in that signaling. So once the pain itself, that all the pathology itself trigger the tissue injury, trigger this pain stimuli, it can cause the dormant or those sleeping areas in the dorsal horn of the spinal cord to get activated. So even if we treat, or even if that particular tissue injury has been removed, the pain can persist in the patient. That may cause this pain to be a chronic pelvic pain.
Doctor, even when the scans and tests are normal, some women complain about chronic pelvic pain. How do you describe this?
That is especially in endometriosis, or like I told you, it is sometimes in endometriosis case, there will not be any cyst or lesions which is visible in the ultrasound or even in MRI. But clinically the patient will be having pain because there is a condition called peritoneal endometriosis which can be only seen in laparoscopy. And as I told you before, the chronic pelvic pain can be a neurological also. It has an impact of too many multifactorial reasons. Even if the patient has been undergoing some other kind of trauma or issues related to even childhood physical abuse or sexual abuse is related to it's shown to be related to the chronic pelvic pain. That is by even after the removal, even if we see that, we cannot deny that the patient doesn't have pain. Patient will be having pain only because of the neurological pathway. That it is also called as a central sensitization because the same pain will continue to stimulate the neuronal pathway, but we cannot see any particular structural problems even in ultrasound.
Now coming back to endometriosis, how do you diagnose a lady has endometriosis?
We can diagnose endometriosis actually even with the proper history of the patient. Only thing is we must be very patient and empathetic towards the patient when she describes about her pain, and how it is affecting the quality of her life and how it is related to the periods. If it is usually related to the periods or just before the periods and it is continuously affecting her quality of life, that means she has to take a leave from the work, she has to take strong painkillers. That means that itself will give us a clue that she is having endometriosis mostly. And another clue we get is by our clinical examination itself. Most of the time the patients will be like, we don't want a pelvic examination. Usually women doesn't like doing a vaginal examination. But the problem is, as you told before, endometriosis may not be present in ultrasound or MRI. Once we do a proper pelvic examination, we can feel that the mobility of the uterus. Usually the normal uterus will be very mobile, and when we move the uterus while doing the vaginal examination, patient will not have any pain. That is the normal this thing. But in endometriosis or pelvic inflammatory diseases or any kind of inflammations in the pelvis, we can easily assess what the patient is going through with this clinical examination, other than the ultrasounds or MRI. After history and clinical examination, the main imaging modality is the transvaginal ultrasound itself. It may show the ovarian cyst which are hemorrhagic, which are called as chocolate cysts. Sometimes as I told before, sometimes ultrasound may not show anything, but it doesn't mean that patient doesn't have endometriosis. And the reports also mainly depend on the quality of the ultrasound machine and the expertise and the interest of an sonographer. Then next imaging modality is MRI, which has a good specificity and sensitivity in the detection of the endometriosis, especially if there are hemorrhagic spots which are more than 5 mm, and there are endometriotic cysts, and if there is an alteration in the pelvic anatomy because of severe adhesions. Next modality is the laparoscopy, which is the gold standard in the diagnosing of endometriosis, because like imaging modalities may not show any findings, and even if the ultrasound or MRI comes as normal, we have to go for an laparoscopy to see directly what is happening inside the pelvis, because some kind of early stages of endometriosis will only show some mild speckles of abnormal areas in the pelvis, but it may be causing too much pain to the patient because of its relation to the particular nerves or sacral plexus in the pelvis. So one problem with the laparoscopy is that only it is invasive and it is expensive, and also patient has to go for under an anesthesia. But the main thing is we can confirm the diagnosis why the patient is having pain, and we can treat in that same sitting, same laparoscopy itself, we can treat the patient. And obviously we are supposed to take a biopsy of the lesions to confirm the endometriosis. But even even if we take the biopsy and the histology comes negative for endometriosis, we cannot rule out endometriosis, because it is said that 24% of cases histology like histopathology may come negative even if the patient is having endometriosis.
Doctor, is there a permanent cure for endometriosis, or is there only a long-term management?
This is said to be a chronic systemic illness which can affect the whole body as such and different systems as such, and it depends on the patients and many factors including genetics or their immunological factors. So 30 to 60% of them can progress to have a severe endometriosis, and there are cases like 40 to 43% of them can get a spontaneous cure by their own. Also, it's not like once endometriosis is diagnosed, patient has to suffer throughout the life also, but in some cases it can affect.
I hope this episode was helpful. Till we meet again next time, this is Jessila Mujib signing off. Good night.